The Fred Hollows Foundation acknowledges the traditional owners and custodians of the lands on which we work and recognise their continuing connection to land, waters and communities. We pay our respects to them and their cultures and to elders both past and present.
Hi, my name is Daniel, and I'm part of the Data and Research Engagement team at the Indigenous Australia program. In January, we spent 3 days in Alice Springs working with the Central Australian Aboriginal Congress to strengthen how we monitor, report, and learn from eye health data across their services. Over the visit, we mapped the full data pathway from how information is collected in clinics through how it's stored, analyzed, and reported back to the Foundation. We worked closely with Congress optometry and data teams to understand their systems, celebrate what's working well, and identify areas where we can simplify reporting. Together, we co-designed a reporting template that reduces manual work and better reflects the activities Congress delivers. We also completed a routine data quality assessment, confirming their systems produce accurate, reliable, and complete data. And for the first time, we piloted our Indigenous Data Sovereignty module, recognizing Congress' strong leadership in community-controlled data practices. Overall, the visit made our partnership stronger and ensured that the way we use data truly supports high quality and culturally safe eye care for Aboriginal people in Central Australia. Thanks for watching.
Hi, my name's Anna. I'm a part-time member of the optometry program team here at Congress in Alice Springs. I'm going to show you what our eye care assistant room looks like, thanks to funding from the Fred Hollows Foundation. So through this way here is a room that we have set up after the patient sees the optometrist if they need glasses made up. We've got a little dispensing station over here so clients can try on their frames, have a look in the mirror. And then we sit the client down, we do all their paperwork to organise their glasses order. We're also very thankful to have a Humphrey Fields analyzer, so a visual field machine. Prior to having a visual field machine, if we needed a patient to have this test, we actually have to send them to a hospital, which just creates another barrier to access that test. Really important for detecting and monitoring glaucoma, also neurological forms of vision loss caused by stroke, this type of thing. So that's really handy. Our allied health assistant, when they're in the role, is trained up to be able to run this test on a client so that they can do it while the optometrist is seeing somebody else. And then, so this is our assistant room. Thank you very much. We've also set it up with a digital vision chart up on the wall because we wanted to set it up with the capacity, potentially, to run 2 optometrists at the same time. We're kind of, I guess, future-proofing program in the way it's set up because we see that down the track we potentially could keep 2 optometrists busy with the demand for services here. Yes, so thanks very much to Hollows for your funding for this program.
Hi everyone, greetings from Nadi in Fiji, where I've been joining in recent days with leaders from across the Pacific for a dialogue focused on gender equity and eye health across the region. I've been reminded of the privilege and opportunity that we have as a foundation to convene discussions with highly influential senior leaders, including current and former government ministers, a former Prime Minister, and many other stakeholders, clinicians and others from across the Pacific. We look forward to sharing further outcomes from the dialogue this week in due course, but the discussions have been so rich. Well, I wanted to share a brief message today with some reflections from a meeting held last week in Bangkok, which brought together leaders from across our country programs, our markets and fundraising teams, a number of our quality and technical staff, as well as some of our support function leads. It was so valuable to have many of our leaders in the same room, which I'm not sure has happened much before. The theme of the workshop was leading together. And so why now, and why make the significant investment of bringing our leaders together in one place? Well, the workshop follows a year of change and transformation across the Foundation, with a number of important shifts that have either been completed or are well underway. As well as realigning some of our teams and functions more recently, we've moved away from a cabinet or consensus model of leadership to one where accountabilities and decision rights are hopefully clearer or getting clearer, and where decision making continues to shift closer to where the work is being done in countries and with our partners. We've also made some important changes with our global leadership team. We've flattened our structure. We've appointed some country-based leaders into global roles. And all these things, I think, will help us navigate the season ahead really well. Well, there's benefits to bring leaders together in any season, but particularly now, I think noting that we're about halfway through delivery on our current strategy. And of course, there are many reflections and learnings to consider as we plan the next phase of delivery. Well, you've heard me share before, our strategy calls us to work differently as we seek to scale our impact. And this kind of change, it just can't happen if we think too much in silos. It really requires leaders from different teams to come together, to listen and to wrestle with ideas, and to solve problems and leverage opportunities collectively, really aiming to have an organisation-wide or an enterprise mindset.